Well, good day, and I'm Ruth Bowick, and welcome viewers to the Healthcare for 55 Plus. Today, my guest is Dr. Rorke Christiuk, and he's with the Optometry Clinic here in Canoras. And in this informative program is thanks to Shaw Spotlight, and I'm so pleased that Shaw Spotlight has invited me to be the interviewer with a number of professionals involved in pertinent healthcare for area seniors. I will add that I am positive everyone viewing this show, not only seniors, will glean a great deal of wonderful information on what Kenora health specialists have to offer. So we're very proud to be able to boast such a great plethora of informative guests to this show. So to get started, now I really am delighted to introduce Dr. Christiuk. And I'm glad you're on Spotlight, and the topic is the aging eye. So let me swing right into you with some questions here that I'm sure that everyone's going to be interested in. Now, I would like you to explain common eye disorders, not necessarily for seniors, but maybe common eye disorders everywhere. Like, what age should let's start with this. What age should your parent bring their child in to have their eyes checked?
Okay.
I know I'm skipping past seniors, but
yeah,
because I think that's important.
Yeah, no, it's good to see infants. 6 months
really?
old
That
be the
young?
first check.
Oh.
And then it's recommended next one be somewhere between age 2 and 3.
Okay.
And once they're school age, it's just yearly.
Just like everybody else, every year.
Not necessarily. Healthy adults are generally every 2.
Oh, okay.
And with kids, they're Ontario Health covered until they're 19 anyway.
Okay.
So all these rechecks are free.
Okay.
And
okay. And then it goes on to. So now we're going to go past this.
Healthy adults between 19 and 65. Generally, if there's no other concerns, they're every 2 years.
Okay.
However, if there's diabetes or corneal conditions or anything, otherwise health related, often they are a higher recall as well. Like every year, 6 months, depending on what we're seeing. And seniors over 65, it's every year for sure, regardless if they're healthy or not. And of course, that recall is upped if there's anything going on.
And OHIP pays for these examinations all the way through to
And OHIP will cover things like diabetes and corneal conditions, infections, all that as well. So it's not a totally de-insured for that center 19 to 65, but it's partially de-insured.
And that gives the people a chance to know just what they should be doing. So if you're over 65, every year, once a year for sure.
For sure.
Okay, so now I'm going to ask about caring for your eyes. So I'd like you to explain the difference between nearsightedness and farsightedness.
Okay, the simplest definition is somebody that's nearsighted can see up close, distance is blurry. Farsighted is a little bit more of a misnomer. The simplest conversion is they can see far away but hard to see up close. But as you get older, that weakens, and then people that are farsighted, they can't see either or. So that's where it gets a bit confusing. Because you take somebody over 40 that's farsighted, they can't see distance or up close. So it's,
really?
Yeah.
So what kind of glasses would they get then? Like three layers? What do you call triple?
Like progressive bifocals or something like that.
Yeah. Excuse me. Yeah, I think I've got allergies now that the spring's here. No, the spring's here and everything's budding. Okay, so now tell me, I've heard about this and I really don't know anything about it, so I'm depending on you to tell me, what is astigmatism?
That's a little harder to explain.
Okay.
It's basically when the cornea is not totally spherical, it's more steep in one direction, that creates astigmatism. So let's think of like a round sphere compared to a football. An eye that's more football shaped would have astigmatism. People think it's a bad thing, it's super common, everybody has it, and it's not an issue.
Everybody has it?
Lots of people have it. Not everybody has it, but it's...
When you say there, okay.
Yeah. And it's, obviously, there's low amounts and there's high amounts as well.
And is that something having eyeglasses will correct, or is that something... So suppose that someone's farsighted and they also have astigmatism, how do you get your lens? Is there a way to get the lens for both of those things on one pair of glasses?
Yeah, it's just cut into the lens.
Oh.
So if you could break down a lens, it would be like 2 different lenses together almost. One power along, say, 180 degrees would be very different from the power at 90 degrees.
Oh, so some goes horizontal and some goes vertical.
Yeah, it's carved into the lens, and it's really easy for the lab to do that.
Oh, okay. And your nearest lab to do that is what, Winnipeg? Is that where your stuff's made?
Winnipeg, Thunder Bay would be the 2 closest ones.
Okay.
Generally, we deal with Thunder Bay and Toronto.
And Toronto?
Yeah.
Oh, that far. That must be very special kind of glasses.
No,
Not necessarily.
that's just where the lab is.
Oh, okay. All right.
At least we can get things shipped quickly.
I find
these
since
days.
I've been doing these interviews, I've learned so much about every aspect of health in my body, and it's been a very interesting job doing all these interviews. So now here's something that really fascinated. What is short arm syndrome? I've never heard of it.
That's what happens when you get into your 40s.
Really? Okay.
Mm-hmm. So when you start reaching for those reading glasses, in the early 40s, everybody says, my arm's not long enough anymore.
I
I
see.
have
It
to
actually
keep putting the
means-
printing farther away.
Okay, so it means the short. Okay, I get it. Yeah, okay, I understand.
Yeah,
it. The
so
short.
it could be
sure.
arms not long enough.
That never would have dawned on me, So. Mm-hmm.
Yeah, so presbyopia is what it's called. It's just the aging of the eye.
Oh, the age. Oh, my goodness. There's so many things to think of. Now, here's some more questions that I think that. Tell me now, a dry eye. What's a dry eye? I thought, does some people not tear? Or?
Well, that can happen. There can be physically less tearing, which happens with age, rheumatoid arthritis, stuff like
Has
that.
a bearing on it?
Yeah.
Is that right? Oh.
The more common dry eye is more evaporative, as in the surface of the eye just doesn't have a good quality of tear and evaporates, and the cornea gets dry.
Okay.
Now, the cornea is highly innervated, so when it gets dry, it's painful. It feels dry, scratchy, burning, often get red. That would be, in a nutshell, dry eye. It's a complicated disease. It's not, super simple, but...
So what would help? Special eye drops that you can buy off the counter at a drugstore?
Artificial tears. Lots of different ones work well. Omega-3 is good for dry eye, the fish oil capsules. And generally, hot compress to the eyelid can get the glands flowing a little bit better,
really?
and that can help too.
Oh, okay. So you don't have to get a prescription really for this dry eye thing.
None of the artificial tears are prescription.
Yeah.
There are better quality ones that you can get through us or certain pharmacies.
Mm-hmm.
But for a basic dry eye, as long as you're doing something,
Very
usually
good.
helps.
Okay, now here's something that you hear so many people have cataracts now. I know I've had it, so I've had the 2 operations.
You've had it.
Yeah.
Ready, both eyes.
But I'm sure some people out there, especially seniors, might wonder what is a symptom that they can sort of think if they're reading the newspaper or something. How do you know that there's a cataract? You wouldn't know it's a cataract till they come in here. But what would be the symptom? I better phone my optometrist.
Yes. Well, right. To reiterate, you don't know it's cataracts till it's looked at, because there's other conditions that can cause blurry vision in that. But generally, vision is blurry. You need more light for reading. You need a lot of that overhead light, especially to see text. That's a sign cataract is forming. And also nighttime. Nighttime is really poor, with lots of glare at night when you have a cataract forming, and difficulty night driving.
I was just going to say about night driving. Someone told me that I should
What did you experience? You had it.
I know, but I didn't even think about that. Someone told me I should get myself, I think there were orange glasses. You can get them at...
For night driving?
Yeah. I haven't bought them yet. Well, I really hardly ever do any more night driving now anyways. I just stay home at nights.
Yeah.
But someone said I should invest in a pair of those.
They're an easy way to cut down some of the glare.
Okay.
So orange, yellow cuts that bright lights at night.
Okay.
Yeah.
Because they are not annoying. Because sometimes in the winter I have to drive to Beaver Bay. I live on Park Street, and just that short drive with there's cars coming at me.
And it's a high contrast lens, and it does help.
So maybe
and that's why skiers and shooters wear orange or yellow when they're skiing. It's the same idea.
Okay.
Yeah, helps contrast, especially at night.
Well, so now we're on these serious things. So let's go into glaucoma.
Glaucoma.
What is that?
In a nutshell, it's optic nerve damage, which will take your peripheral vision away first, generally.
Have you got a picture of the optic nerve on this thing behind you? I don't know if you can.
Can you see it?
I don't know. Would you be able to see it? She would. She said yes.
Okay.
Because I'm not sure I know what the optic nerve is.
Okay. So, if that's visible,
Can you see that all right, Vic? Mm-hmm.
this is the cross section of the eye. There's the front of the lens there. That is the lens right in the middle. That's what turns into the cataract. This is all retina that coats the back of the eye. And that little tidbit you can see there,
yeah, sticking up kind of.
That's part of the optic nerve.
Oh.
So the optic nerve is what carries the visual information all the way to the brain.
Okay.
Now, glaucoma damages it basically locally right at the nerve head as it leaves the back of the eye. So the most common cause of glaucoma that people think of is high eye pressure, which mechanically damages the nerve head. Now that's a simplistic view because there is other types of glaucoma and it's not completely eye pressure related. But regardless, it's damage to the nerve fiber layer that is the definition of glaucoma.
So there's no really cure, there's just like...
Slow it down.
Or just, there is something you could...
Yeah.
Now is that the same case? I'm going to move on now to a macular degeneration. I have that,
it's a very
and I
different
find
condition
that
than that.
Mine slowed down immensely. I don't have to go to Winnipeg now every 6 months instead of every month. So that's the right. It's needles in my eye. But what gave me that? How come I got macular degeneration?
Birthdays?
Oh, just the age. Okay.
Genetics.
Yeah, I'm getting up there.
There's other risk factors as well. You know, for example, smokers. You know, a lifetime of smoking, often macular degeneration, more severe. Sunglasses, they've linked sunlight exposure, not wearing enough sunglasses as you age is linked to that. Those would be the top ones. There's also loose links between high blood pressure and cholesterol and all that stuff too.
So other health things that's wrong with you might have effect of macular degeneration.
But the big one is genetics and age, for sure.
Well, I can see that because I might...
Certain descents have very high macular degeneration prevalence and others don't.
Okay.
So...
And there is a wet and a dry, and I believe, if I'm not mistaken, if I was told, I think I have the wet, and I think, is that the worst?
That would be probably the worst format, yes, and that's what they treat with ocular injections.
Okay, so why, if you have dry macular degeneration, it's not so bad, but, like, how bad is it?
Well, it can lead to vision loss as well, but it's generally not as quick and profound as the wet form.
Okay.
If you went through it, you probably noticed an abrupt change in your vision. One day you couldn't see as well, right?
Well, you know what happened to me, and I came here right away, so I think that was helped me. I was reading, because I read a lot, and all of a sudden the words are going off the page, and I could actually read the words. And they're up here. They're not here, like I could see the words. I thought, well, what is this? You know, I better phone my optometrist. So I got in right away, and so I had it taken care of right away. But
that's what it was.
Imagine, it was the funniest thing. I can't hardly explain it, but you could actually read the words going up in the air.
So like the earliest probably symptom of a wet macular degeneration, it's an abrupt change in one eye. So people, especially if you isolate the eye and look at something, you'll see either a blind spot or a distortion in the printing. You know, the uniform print will not be uniform anymore. And that is literally the wet blood and fluid underneath the retina causing distortion in your retina. Because the retina is kind of your camera film, and if you crinkle it or do anything to it, it affects your vision. So, however, it can go undiagnosed for a while because we have two eyes. And if one eye takes over, the person doesn't always notice the problem in the other eye. So that's where monitoring macular degeneration, and you should be doing this as well, is, you know, blocking off one eye and checking with a grid or a uniform, you know, printing.
Yeah, I think I have that grid at home, but I don't even know where it is. It's that with all kinds of lines and everything. And
it's called an Amsler grid.
Okay.
Yeah. And it is just literally a grid paper.
So you think I should block this eye and do what? Read or just
make sure there's no new defects or distortions.
Oh, the eyes are going bouncy or something. Oh, okay. Yeah. I didn't know that. Okay. Now I got to find that little piece of paper that's got all this. I know I didn't throw it away.
You know, it's a proactive way just to pick up on early changes. And of course, if you see something, then we're having you back here and we're doing scans of the back of the retina like you get every time.
Well, I'm certainly glad that I caught it in time.
Yes.
I mean, it's something that won't go away. But
those ocular injections have been like probably the biggest breakthrough with macular degeneration in years, and it's saving people's
10 years.
vision.
I was just going to ask you, how long has that been around? 10 years, you said?
I don't know if I said 10 years.
I thought you did. I'm sorry.
Boy, how long? It's been at least 10.
At least, okay.
Probably a bit longer.
I wonder who invented that. Isn't that amazing? And you don't even feel the needle going in, too. It's neat. Like, it's really neat.
Hopefully you don't.
Hopefully.
It's not always like that. But they found out that drug happened to work in colon cancer patients. So they were using that drug for colon cancer, and somehow somebody smart found out that it was reducing wet macular degeneration. Because prior to that, there was no treatment for wet.
Oh, for goodness sake.
You just literally went
blind.
blind.
You lived with it.
You went blind.
Had Coke bottle glasses, they used to call them.
Nothing would even help that.
Wow. Oh.
So that's originally how...
Isn't that amazing? Wow.
And then, of course, they adapted it to the eye and stuff like that. So originally, that's how it started out.
Well, that's really interesting.
Yeah, it is kind of interesting.
It sure is, yeah. So I think that, oh, and there's another one, and I've never heard of this one either. Diabetic retinopathy. You said
it right.
Okay.
Diabetic retinopathy.
Does that mean if you're a diabetic, that's what you're going to get, or does it matter? You get it anyways without being a diabetic, or is this?
No. You have to be diabetic to get it.
Oh, okay.
That by definition, diabetic retinopathy.
So
now,
is it
there's other retinopathies.
Oh,
so
there is there.
Diabetic retinopathy is specifically to somebody that is diabetic.
Oh, I didn't. So there's more than one kind of retinopathy.
Sure, there's high blood pressure retinopathy. There's infectious. There's a variety.
What does it do to your eyes? What would you be seeing if you had this blurry stuff?
Maybe nothing.
No. Oh.
Maybe blur.
Okay.
So if you get blood and fluid leaking into the retina of your central vision, you will see distortion and blur, much like you would with, macular degeneration or anything like that. It's hemorrhaging of the small blood vessels. That's what diabetic retinopathy is. Now, generally, you don't get that right away. You have to be diabetic for 15, 20 years sometimes before you show any sign of it.
Oh.
And hence, that's why we like to see diabetics yearly to pick up on the earlier retinal changes.
Yeah, you took the words right out of my mouth. That's why it's important for everybody to have an eye examination every year.
So, for example, if we're monitoring a diabetic yearly and we start to see some of these small hemorrhages in the retina, it would spur us to contact the family doctor, possibly do a better job of keeping the blood sugars perhaps lower.
Okay.
Because it is a bit of an insight. If you see it in the eye, that means the other organs are doing that as well, even though you can't.
You mean other organs in your body or in the other eye? In your body?
Feet,
so
feet, kidneys, liver. Yeah.
This diabetic retinopathy can do all that? Affect your livers and your kidneys?
It's body-wide, right? So what happens is the high blood sugar content over many years damages the small vessel walls, and that's how they ends up leaking blood and fluid. So
right out of your eye? You mean the blood will come out of your eye?
No.
Oh, okay.
No,
sorry.
It's in the back. It's in the retina back here.
Oh, so it's leaking back in your brain somewhere.
Have you seen or have you heard about diabetics having poor circulation to their feet?
Yes, I have. It goes in their toes or something?
Correct. So the foot is a peripheral thing, much like the eye is. So hemorrhaging and neuropathy happen in the feet, and then that's how diabetics end up getting amputations and stuff like that. So obviously you can't amputate an eye.
No, I guess not.
But, well, I guess you can, but
that would take the eye out.
Yes, that wouldn't be advisable.
And then you'd have to have a glass eye. Do they still make glass eyes? Do people still wear glass eyes?
Yes.
Oh, they do, eh?
It looks better than just a
hole or a thing over your patch over your head.
Yeah.
Yeah. So.
Tangent.
So, I kind of ran out of questions here. Is there anything you'd like to tell me that you want to screen this down a little bit, because there was something I didn't think we'd have time to just screen it down from what you sent me to the house.
Looking for near side, far side. It's
astigmatism. We've done all that. Correcting your vision, correcting. There, stop. Let's go into laser surgery.
Laser surgery.
Yeah. Is that when you have spots in your eye, like little spiders, webs?
That sounds like floaters.
That's
nothing to do with LASIK.
Oh.
Do you want me to talk about floaters first, or
do
LASIK?
Floaters then, because I have some in one eye, the macular degeneration eye.
Okay, so that's a common complaint we see lots of people every day with, a new onset of floaters or maybe flashes of light. Floaters are a normal part of the aging eye.
Oh, okay.
It's that eye jelly that is in that back part of the globe, essentially just sort of disintegrates over time.
Like breaking off or something?
It sort of breaks down.
Okay. And that's why you see.
And then you're left seeing the little protein collagen fibers floating around. Now the problem is, if that supportive eye jelly stops supporting the retina, you can develop a retinal tear, which can turn into a retinal detachment. So hence why we would look at you right away, dilate the pupils, make sure there's no sign of that. If a new floater starts or a new flashes light or anything unusual in your vision.
So I'd have to watch for that then?
Yeah.
Okay. So let's do this other one, the LASIK.
Laser
what exactly
surgery?
is LASIK? Is it LASIK? Is I saying that right? LASIK?
Yes, LASIK is modifying the prescription of the cornea to correct for nearsightedness typically. They can do farsightedness to a degree, but not near as prevalent as being a nearsighted person.
But LASIK wouldn't use for macular degeneration or anything like that.
No,
Strictly
that's-
for nearsightedness.
Think of it
LASIK.
like a permanent contact lens.
Oh, really? Okay.
So they're just literally just lasering the cornea only. They don't touch anything else, and it just corrects your vision.
Okay.
So not something that most people over 55 are getting.
Most people are getting it.
Are not
getting it. Okay.
So it's best to have laser correction in your younger years when you have lots of time to enjoy the freedom without glasses.
Can you do that here?
That's done in Winnipeg.
Oh, in Winnipeg.
There's
But I hear now for macular degeneration, like I still have to go to Winnipeg now because I started there, but apparently there's a professional coming down from the city, once a month or something?
Once a month.
To get the needles here now. That's wonderful. That's really a great service you're offering here in Kenora.
Yeah, Dr. Stockel comes. We had another surgeon as well coming. He comes every month.
How long does he stay? 1 day or 2 or a
He
week?
just comes usually on a Friday.
Oh,
And
on Friday. Oh, okay.
we give him all 4 of our exam lanes, and he is running scans and injections
So he
here.
must be working from the time he gets here till the time he gets ready to go home, then steady, one after the other.
It's very busy, very busy, and it saves people a lot of driving, obviously. So typically to get an injection in Winnipeg, you're driving up 3 hours,
Yes,
and you're waiting
I know.
3 hours.
And you're waiting. Yeah.
So less
And
wait,
they-
less driving, and this is supplying all of northwestern Ontario. And we have people from Red Lake, Dryden, Fort Francis.
Come down here.
Yeah.
Okay. Oh, they do, eh?
'Cause
So he
there's-
doesn't go to those places. Everybody comes here.
Everybody comes
Fort
here.
Sioux Lookout, Fort Francis, Dryden. Yes. Okay.
There's no retinal surgeons in Thunder Bay. They do injections in Thunder Bay, but there's no specific retinal specialty there. So the only retinal surgeons are in Winnipeg, and there's only a handful of them. So it's
Winnipeg.
fortunate, that we have.
Have you been to their new clinic, the one, the Manitoba clinic?
I have not been to the new
Oh my
Manitoba
gosh, it's
clinic.
gorgeous
I
compared
hear-
to the old
I
one. Oh my
hear it's
goodness, yeah.
nice compared to the
little
old
off topic here. So I'm going to close in a minute. I think I've maybe got about a minute left. But is there anything that I haven't asked you that you'd like to tell me to stress about, especially for 55 plus? Because this is, for the seniors.
Yeah, getting the eyes checked regularly, routine eye exams. I think we touched on all the big issues. Of course, there's all kinds of other things that can happen. The big key is being alert to changes in your vision,
And again, I'm going to stress the most important thing is making an appointment for your eye check once a year at least when you're over 55.
and if you're a perfectly healthy adult, every 2 years is generally fine.
Yeah, but if you're over, I'm thinking if when you're into the 60s.
Over 65,
Yes,
yeah.
yes. Mhm.
And that's mainly because Ontario Health only covers you over 65.
Oh, okay.
But there's absolutely merit to maybe dropping that down to every 60 years old. You should get your eyes checked every year, and it's variable between everybody. I mean, people can develop macular degeneration at ages 50.
Oh, really? Oh, I thought it, okay.
So
Well, I'm going to tell everybody I'm over 50. Okay. Well, listen, Rorke, Dr. Christiuk, Rorke, right? Your first name. I like the way you spell your name. Thank you so much for giving
Thank you.
of your precious time to.
Thanks for having me.
Yeah, thank you to give up your precious
hopefully
time to come and do this show for
help people.
It's called Spotlight, and I will let your staff know when it's going to appear, and somehow you can get to watch it on Channel 10. So thank you again.
Okay.
And I shall return with another good segment on Spotlight from cable. Thank you.